100 years ago, the Woods Hole Women's Club made the recommendation to establish a nursing agency for Falmouth and the residents to meet their health care needs. And what started as one nurse on a bicycle, it's developed over the years into the VNA of Cape Cod as we see it today. What we're seeing today is a lot of changes, and the quality of the care that we're providing is really being measured as it is in the institutional settings as in hospitals. Most patients, regardless of how sick they are, would prefer being at home. They want to be with their family, they want to be in their own environment. They tend to heal quicker, they tend to be more compliant than in a hospital setting. And as they're discharged sooner, we're able to meet those needs in the home by providing that level of care that years ago they would have received in a hospital or in a skilled nursing facility. The VNA has been using an electronic medical record for many, many years. They were on the cutting edge years ago.
Technology-wise, the advances have been tremendous, and the phones and the ability to take photographs of the wounds and then email them to physicians has helped with the communication tremendously. And amongst other nurses, instead of a nurse waiting for us to try to get to see a patient, they can email us a photo and we can do a lot of education right there over the phone.
The laptop computer certainly saves us mileage, so we're not circling back to the office to deliver a paper chart. So that's huge.
Our staff are pretty much virtual, and we try and keep them out in the field working so they don't have to come into the office.
I think care is improved because we can really expedite things more quickly. We can recognize certain trends more quickly because of the telemonitor. The telemonitor is ideal for certain patients that have issues with their weight. It's part of their disease process that they might gain weight, and gaining weight is very insidious. It can kind of creep up on them. So by having sort of a structure to get on the scale, and then they can do the vital signs with the monitor, all that information gets transmitted, and the fact that it's a sort of daily routine and it's transmitted so that we can see it and through our laptop, doctors' offices can see it. It gives the trend and not just one day's worth of data. So for some of our patients who are just barely staying out of the hospital, it's been very key.
They've been a tremendous lifesaver.
They were phenomenal. I can't say enough for the VNA.
They've enabled us to keep going here at our home.
And it is such a relief for my husband to know that I can be taken care of with VNA.
They taught me so much of what I needed to do as a patient to recover from such a major surgery in my home.
I had the VNA come in, and I recommend that extremely highly. I didn't want it, but I really did. And the rehab, the people, and the quality of the people that they have that come in, once again, they were of the caring group, they were of the listening group, and they went around and they once again made me feel a lot comfortable.
Jesse is the middle of 5 children. He has 2 older sisters and 2 younger brothers, and he is 5.5 years old, currently a kindergartner. He's being treated for high-risk stage 4 neuroblastoma.
We have a bunch of families on the Cape that the VNA sees, and there's a group of us that just see children.
Ellen brings so much joy to our lives it's been 2 years that we've known her through really hard times, and she has always been there for us in so many ways. Never known Ellen before, but have her become so close with us. It's a silver lining to all the trouble that we've gone through.